Looking at squats from the frontal plane, I get people to generally stand feet slightly wider than hip width, maybe shoulder width apart, sitting back into a squat. And I get people to do the squat first and see which response they go to first, or which pattern of movement they go to first. For valgus collapse patterns, which we typically see, I would use a mirror or cue people either visually with the mirror or cueing them to just keep their knees out and keep them in line with the middle part of their foot or their second, third toe as they go into their squat, and see if that corrects. Sometimes using actually tactile or hands-on cues can be quite effective, or the use of a TheraBand around the knees to facilitate that pushing out or the external rotation movement as they go into the squat. Looking from the sagittal plane, I again let people go into the squat naturally first to see if they go into a knee bias or a hip bias squat straight up, and then cue them from there. Typically, I would get people to think about, especially if you're looking at hip bias squats, think about sitting back onto a chair and probably use, or a box, and probably use that for the squat. I often get cues, especially for people who are rounding through their trunk to think about keeping their shoulders back, and the visual cues can be useful as well if you get a mirror side on to help people from the squatting from that side of things as well.